I am a physician here at WellSpace, caring for low-income children and families. I've practiced for over a decade and a half caring for people in the Medi-cal program, working to expand coverage and access to health care for people in Sacramento and California. I have personally struggled with my patients and their families getting the care they need, completing numerous forms, making phone calls, even talking to elected officials in the past about how do we get them care. And since my election to the legislature, I have sought to make the Medi-cal program more cost-effective, more transparent, and more accountable. The legislation that Assemblymember Nancy Skinner and I are introducing today continues this very important effort.
In 2011, when we were still in the depths of the recession and having terrible problems with California's revenue, we did a bill that slashed the Medi-cal rates by 10%. We are not in the recession any longer. While we have Californians who still haven't benefited, yet the recession hasn't pulled them up, the California budget has. We're in a surplus situation now. So we now have the responsibility and the obligation to raise those rates and to make true the delivery of the Affordable Care Act as we have committed to do so.
Medi-cal already serves 8.5 million Californians, and an additional 1.3 million Californians will qualify for Medi-cal thanks to legislation passed last year, authored by Speaker Jean Therese, and the Affordable Care Act. These patients are among the poorest and most vulnerable residents of our state. Unfortunately, there's also been a long history of Medi-cal rate cuts and freezes, resulting in patients having difficulty finding care.
1 in 5 Californians, 1 in 5, now are Medi-cal recipients. And for very long, we've viewed sort of Medi-cal as being something, as Dr. Pan described, for our most vulnerable Californians. And yes, the long-term poor obviously are served by Medi-cal. But all of us know friends and family who during the recession lost jobs, lost homes, you name it, and they now find themselves people who qualify for Medi-cal. So we have so many more Californians who are now Medi-cal recipients. When we order an extra large pizza and we have it delivered to our house, we pay a bill of about $24. That's the same amount that Medi-cal reimburses some physicians for some services. Now, a pizza or the payment to a doctor? To me, it's clear what is the more important and valuable service, and it deserves a rate that reflects the service that's provided and gives the quality of health care that we believe in.
The Medi-cal program, the California Medicaid expansion, is a part of the backbone of the expansion for the Affordable Care Act. As has already been alluded to, the Medicaid program is already among the lowest that is reimbursed in any state in the nation, and one of the most expensive states to practice in. The analogy of the cost of a pizza versus the cost of seeing the doctor is not lost on those of us who see patients on a day-to-day basis in our practices.
Recently, I have gotten notices from Medi-cal telling me that I am most likely going to have to lose my doctor and my hospital, and this is all because of the cuts to, I guess, UC Davis is not able to take care of me because they're not getting paid enough to do it. And thankfully, these people behind me are willing to stand up and say, hey, you know, we're not paying these great doctors that are keeping these people alive and working and able to be part of society. And hopefully they'll get my doctors and my hospital the money that they need so I can be taken care of.